Okay, now we're going to cover managing difficult behaviors found in dementia. Difficult behaviors include hitting, biting, resisting care, spitting, and kicking others. Challenging behaviors most often occur because the person is frightened and or frustrated. Behavior is a form of communication or a solution to a problem the person is having. For example, hitting the caregiver while being undressed is the person's way of telling the caregiver that he or she does not want to be showered or changed. The best way to manage behaviors is to manage your own behavior with our dementia clients. I'm going to stop a little bit here and reference back to our communication. When I talked to you earlier about communication, I shared with you that the communication was communication to and from. So now that we are going to get into managing behaviors, always keep in mind that how you communicate to the residents plays a big role in preventing some of these behaviors. The best way to manage a behavior is to manage your own. So again, caregivers, all staff need to smile and slow down when approaching a person with dementia. Make eye contact with them and use simple, clear communication so that the person can understand. Also, when you make eye contact, make sure that you know and understand that in some cultures, eye contact can be disrespectful. But in America, it is common to keep eye contact to show interest. Possible causes for unwanted behaviors. The inability to understand cannot process what's being asked. So this just means that the resident can no longer communicate to you and they're having a hard time. Therefore, they're going to get upset. Overstimulation, too much noise or confusion. If there's a lot going on, too much music or people being loud, sometimes this causes the resident to be overstimulated and a behavior occurs. The task may be too difficult, may not understand what they are supposed to do. For example, we're asking the resident to bowl. What if they don't know how to do that anymore? This may be too much to ask them to do, and then the behavior occurs. They get upset and they might start hitting or they'll start yelling. Communication difficulty, not being able to express needs or understand what's asked. In this one here, the resident may not be able to tell you what they want to eat. Maybe they don't like the breakfast that's in front of them, but how do they tell you this? Because they can no longer communicate. So instead, they'll throw the plate. That doesn't mean that they're at risk for harming you. That just means they're trying to communicate that perhaps they don't like their breakfast. Misinterpreting what is said. Whispering may cause the person to think they are being talked about. Keep in mind, when you are with the residents and you are talking to another staff member, try to include the resident. If you whisper and or talk behind their back, they'll think that you are talking about them. And again, they may not be able to communicate the anger towards you, so they're going to be upset, and that's when the behaviors occur. Misinterpreting what the person is doing. Undressing for a shower may cause the person to think a sexual activity is taking place. Always keep in mind that when you do something with a resident, make sure that you tell them what you are going to do. For example, if you're taking a resident to the shower, make sure you let them know, "Hello, today's shower day. We're going to have a shower." Ask them if it's okay to do so. If they say no, then make the attempt again in another 15 or 20 minutes. Physical problems are not feeling well. Pain makes people agitated. I'll give you a little story. I had a resident at a community who was having lots of behaviors. Staff didn't know what to do. Residents were frightened. The family didn't know what to do. And they actually came to the community and said, "My mom is used to taking medical marijuana." Well, I said, we can't do that. So we did a full assessment, full body assessment. Everything came back normal, labs came back normal, and after multiple attempts, resident was throwing plates, breaking glass. I asked the staff or the licensed nurse to call a dentist. All the assessments had been done, including checking for ingrown toenails and any wounds. We did labs to make sure there was not a urinary tract infection. When the dentist came out, we discovered the resident had a poor, badly rotted tooth. Pulled the tooth and the behavior subsided. Always keep in mind that there are and may be things that the resident can't tell you, therefore they're going to cause a behavior. So those are some of the physical problems. Being treated like a child increases the frustration. At Rise Paradise, we do not use childlike toys. We don't carry around baby dolls. We don't do coloring. We don't use coloring books. This makes it seem as if we are treating the resident like a child. And again, they may not be able to communicate to you, so they're going to get upset. Startled by a sudden noise or movement, they may hit you out of fear. Again, if you approach them from behind and you come to them and you let them know, or you don't let them know, they might hit you out of fear. Conflict with other residents. So again, no impulse control, and this goes back to some of the reasons why the dementia occurs. Maybe somebody has Lewy body, which is the short-term memory loss, the judgment is off. This will cause resident-to-resident altercations. So keep in mind and watch surrounding areas at all times. The desire to leave. We talked about this earlier in our presentation, residents wanting to always go home. So some of the key things that you can do is maybe ask the nurse in the wellness center to get the phone and you get another phone, and have the resident simulate as if they're calling their own family member and or making arrangements to go home. But in fact, they're really calling the nurse at the wellness center. You're not lying to the resident. All you're doing is causing them to have some kind of comfort that we're trying to do the best we can to keep them safe. Remember, residents' behaviors always occur because they have fear of the unknown. Some of the risk factors that increase challenging behaviors. Being in a new environment, new to Rise Paradise. Undiagnosed pain, a headache, toothache, ingrown toenail. Physical problems, shortness of breath, a urinary tract infection. Boredom or loneliness, a negative approach from a caregiver. They will copy caregiver's mood. Sundowning, regular increase in agitation in late afternoon. So let's talk about the negative approach. Sometimes when you come to work and we've got a lot going on at home, if you have a lot that you are trying to process from your home-like environment and you bring it to work, the residents will know, they'll see it, they'll feel it, and then some of the behaviors occur. Try to make sure that if you are not doing well for the day and having your own personal issues, that you leave them at home, because when you come here, our residents are suffering from memory loss, so they can't comprehend everything that you are going through. Your behavior mimics their behavior, or vice versa. Sundowning. I know you see this term and you may not know what this means. Sundowning, the description of it means that the sun has gone down. So back in the day, most of our residents and most of families today, at 5 o'clock when everybody's done with school and you come home from work, the normal routine is as a family, you're going to sit down and have dinner together and or perhaps watch a movie to end the day. So sundowning means that these residents need to go back into that normal routine. So after dinner, they're looking for their family members, or they're getting increased agitation because the sun is down. Their mind is triggered that they need to sit down with their family members. Some residents may even look for their children. Just know that providing peace and comfort to them, letting them know that everything is okay, sitting down with them and reading a book and or watching a movie will help eliminate some of these behaviors. Some ways to prevent unwanted behaviors. Don't argue with the person. Give reassurance to the person. Offer drinks, popsicles, anything, any type of snack. Find a quiet spot away from the noise or congestion. Turn off background noise, the TV or the radio. As residents move into Rise Paradise, you will get to know every person and their likes and dislikes. Some residents don't like it when it's too noisy, and some residents like the music and they thrive from it. Once you get to know your resident, if you start to see that a behavior is occurring, you will know whether or not it's too much stimulation, or they want more, or they just want a snack. Preventing an injury. At times, the person with dementia may lose control and become combative. It's important to know the subtle changes and signs of escalating behaviors. Observe the body language for clues: clenching fist, banging on the door. Some of these clues include frowning or scowling, rapid eye movement, muttering under the breath, yelling, wringing of the hands, waving arms, and pacing frantically. Remember, as we went through some of the disease process and I went through the steps of the dementia and or Alzheimer's, I shared with you that residents lose the ability to communicate. Some of our residents can no longer communicate. So when they're upset, some of these things may come out. You'll notice by their facial expressions or your facial expression. You'll notice if they clench their fist, that means that they're angry, or they start pacing back and forth, that means something is wrong. So in order to prevent all of this, look for all of these warning signs. Some of the steps for intervention. Redirection or distracting the person from what he or she is upset about long enough for the person to forget what's upsetting. For instance, a resident who continuously says they want to go home. So what can we do to redirect them? One of the tips that I gave to you was making a phone call to the wellness center and asking the wellness center nurse to act as if they're their driver and or a family member and is going to validate some of their concerns or feelings. Back off. Sometimes the change of a face will help. If you're having trouble with a resident that's having a behavior, don't hesitate to grab another nurse or grab the licensed nurse and say, hey, can you come and help me? Sometimes even the change of face will help the behavior minimize. Using bribes such as food or an outing. Taking the resident out for a simple walk may help. Sitting outside in the patio area may help. And or saying, let's go for a ride. All of these interventions will help to preventing the behavior to get worse. Again, validating, letting the person know that you understand. Don't dismiss what they're trying to tell you. Don't act like you don't know. See how you can help, and validating what they're trying to tell you will all help prevent the further escalation of the behavior. Physical management of aggressive behavior. Give the person space. Be patient. See what the person will do. Keep your hands by your side. Stand to the side of the person so that he or she can't kick you easily. Have only one person doing the talking. If you must approach the person, approach as a group. This is mostly if you already see that the resident is becoming physically aggressive. Try to talk to them by yourself. If not, get some help. If 2 or 3 of you approach the resident all at once, then the behavior will escalate. Prevention of caregiver injury. Don't wear jewelry that has sharp edges. No necklaces that the person can grab. No earrings that the person can grab. No open-toe shoes or sandals. And keep space between the caregiver and the agitated person. Releasing the hold if attacked. So what do you do if a physical intervention should be only used under extreme situations? The purpose of the intervention is to prevent injury to the attacker and others in the area. So biting. Don't pull away. Don't shout stop. Gently pinch the person's nose. If the person is biting your finger, push your finger in further into their throat so that they will gag and let go. These are some of the extreme behaviors that occur. Again, all of this can be prevented if we clearly communicate and we listen to the resident. Grabbing. Don't pull away. Stroke the attacker's arm that is holding you, and this may distract them. Pick up the thumb of the attacker and gently pull back, or place your hand over the attacker's hand and squeeze. Hair pulling. Don't pull away. You'll cause further injury to yourself. Push your hands toward the attacker. Place your hand over the attacker's hand and squeeze until released. A raised object. When a person is holding a walker, cane, or chair in the air, it's a threat. Never grab the object. Grab a pillow, a broom, or another chair and tangle the 2 items together. Once the items are tangled together, lower them to the ground. So I'll give you an example. We had a resident who was upset, wanted to go outside for a walk. The staff was busy and didn't feel safe taking her out. When they got distracted, the resident walked over to a drawer, opened it up, and grabbed a knife. Unfortunately, then she had 2 knives in her hand and began threatening the staff along with the residents. It wasn't until another staff member came into the home, distracted her, opened up the back door, and took her out for a walk that caused her to stop being so upset. So if a resident gets an object and threatens to use it with somehow, try to validate their feelings and agree to what they want to do to prevent any injury to themselves, to any residents, and to yourself. Now we will take a break.